Okay, my name is Zoe. I'll be demonstrating how to properly clean and dress and bag a patient that has passed away. So first you check your healthcare policy, gather all your belongings, check their identity, verify your name, date of birth, especially with family. Take care of the family, let them know what we're gonna do, get them anything they need. If they need to step out, that's totally fine. So we verified him, we know who he is. So if he has dentures or anything, we'll put them back in his mouth once we wash him. So right now he doesn't have a gown on. They're supposed to have gowns on, but he doesn't have a gown. And he's all covered up because he doesn't have a gown. All of his soiled clothes have been bagged and tagged with his identity on it. And we're gonna comb his hair and make him look all nice and presentable. After that, we will give him a bath. So we'll wash any soiled areas because fluid can escape through the mouth, rectum, urinary tract. So we'll wash him, and then after that, we will leave like a wedding band or a wedding ring, whatever they have, special necklace, jewelry, leave that on them if stated by the family, and we'll tape it to make sure it stays on. If not, take it off and put it with their belongings. After that, once his dentures are in, we'll close his jaw with gauze tape to make sure that they stay in.
Now we're going to move on to our secondary. Okay, we are at
All right. Once they are like tied up there, you'll keep their hands and feet down at their sides. You may have to use like these little strings to keep their arms down. For this mannequin, we don't need to use them. So after they're all clean, they've got their jaw tied, dentures in, jewelry off, family's taken care of, you'll roll the patient towards you. You can call an assistant too to help if they're too heavy. You'll roll them, place the bag under them, zip them up. Then you'll call like your morgue to come pick them up or whatever your hospital policy is, and let the family know like the process of doing that. And then after, you'll clean your hands, but we'll bag him first. Oh, before you bag him, actually, you need tags. You need a toe tag. This will tie onto their big toe to identify who they are. And then, your contaminated tag. That'll be like any clothing or anything that you take off of them that was on them when they passed. Sometimes you need a tag for the bag too. Uncover your patient.
The patient has a gown on.
Yeah, the patient's supposed to have a gown on. This one does not for some reason. Do you want to roll towards you?
Yeah.
Okay. So, you'll roll your patient same as you would any other patient. Place your bag under. Once your bag is kind of centered, you're going to unzip that when they roll back, they'll be kind of inside the zipper area. Alright, we can roll back. You can also kind of adjust your patient to make sure that they are centered and in the right position. Once they're in your bag, you will zip them to keep them covered. And then you'll call your morgue or whatever you need to do to get them to their next destination. And then you'll doff all of your protective equipment, gown, gloves, wash your hands, and then let the family know.